I know I look like a mess, but I can't wear makeup, and that's because I'm going into this Allied Physicians Surgery Center today, this morning at 7:30 or something like that right now, and I'm here with my mom, and I'm nervous because I'm gonna get my nose worked on. It's been broken for like most of my life, so I'm gonna get that fixed, and so that should be interesting. I'm kind of nervous, but I'm also excited, so I know I'll look beat up after this, and we'll get some footage after that. Till then, peace out.
So how are you feeling, Ashley?
Pretty good. They gave me a little bit more medicine to make it because I'm starting to feel sore.
Okay.
I can still feel pressure on it.
Yes. Dr. McTigue said that it looked to him like you had broken your nose numerous times. That's the word he used.
That's what he told me.
Yeah.
Before. I don't know how they could tell that. I'm not as loopy.
Yeah.
But,
well, that's good.
Oh, that's the thing.
Yeah, that's like the little cast, or.
But it's bigger than I thought it would be.
And he told me that he gave you 2 prescriptions. One was an antibiotic and then Tylenol with codeine.
Yeah, codeine.
I hope that doesn't make you sick to your stomach, though.
I know, but it's so.
Yeah.
I thought it'd be more loopy, and I can't believe that it was so. It just doesn't feel.
Like you were even under?
No. When I looked at the clock, it was like 9:25.
Mm-hmm.
They said I could wear it. Oh, I have this too. It's the IV.
Oh, okay. Yeah.
But I really wasn't nervous that much like I thought I would
I'm so
be.
glad. Actually, when Dr. McTigue came and talked to me, he said that you're such a sweetie. That's what he said.
Really?
Mm-hmm.
Well, they're real nice here.
Mm-hmm.
They gave me a blueberry muffin. I had a choice between like that banana and several other things.
Uh-huh.
I'm really relieved, though.
I'm sure you are, Ashley.
Nervous,
now, he did say that you might end up with a headache, and then that you might also look like you've got 2 black eyes.
Yeah.
But that will go away.
I'll just tell people I got in a fight. Sorry, I'm not more loopy, though. That would have been kind of funny.
Ashley.
I don't know if it's because they gave me something different, but last time when they extracted my teeth, my 2 wisdom teeth, I was like crying or something, but this one I wasn't, but my mouth was super dry.
Actually, Grandpa Wiggins came here a few years ago for some procedure, and he said that he felt so good when he came to.
Yeah.
So it's whatever it is that they use.
Yeah, they're super good here, though.
That's good. I'm so glad.
They're so at ease and nice here.
Yeah.
And they gave me, I remember going in there, it was a real narrow bed, like about this.
Uh-huh.
And they gave me a blanket like this to lay on because it was warm.
Uh-huh.
Because they were honestly saying that it is cold back there.
Yeah.
And then when you lay down, that they put the blanket over you like this, but it's real warm.
Uh-huh. Did they say, like, are we supposed to change that gauze over your nose? Okay.
But I remember they gave me like a thing into IV, like right here, and I looked at it. It was like a real thick white stuff. It was interesting.
Now that was before you went to sleep?
Yeah.
Okay.
And then I said, yeah, that I'm feeling more relaxed. They were hooking the EKG stuff up.
Mm-hmm.
But I don't really remember anything after that. It's kind of weird. I wanted to be able to see the mask thing that they put over.
Yeah, just keep eating, honey, so that you have something in your stomach.
But I woke up hearing Atlantis Morissette or something.
Oh, really? You mean you woke up in the operation?
No.
Oh, okay. But just after the operation, they had music playing?
Yeah, in the waiting room.
Oh, okay. Wonder if they do that to help you wake up.
Because you somewhat breathe through your nose automatically.
Yeah.
When I try to swallow, it keeps popping.
Oh,
Not my nose.
yeah.
Like the air trying to go through.
Yeah. That's going to be uncomfortable for a while.
I told her, I said it felt like tampons up my nose.
He said that they were dissolvable things up in your nose, clear up in your nose that will
Really?
dissolve. So they probably have it packed clear up in there. And I know when you come back, I don't know if they take anything out of your nose.
Yeah, they do.
Okay.
That's what Dr. McTigue said.
But the stuff that's way up in there, he said, is dissolvable. So they had to give you some pain medicine because you were in a little pain, just a little
bit.
Yeah.
It's just like pressure.
Yeah.
It still feels like a little pressure, isn't it?
Yeah. Well, I'm glad for you too, Ashley.
I bet you anything that they would have reported, I bet they would.
Really? Yeah.
And the more I thought about it, I just kind of didn't want to see that.
Yeah.
I would on someone else, but just probably not me.
Yeah. He did tell me that you might cough up a little blood, but that's just because you're
it's going through the
yeah. But he said that would be normal.
Okay. So not to panic.
Yeah.
Boy, I'm really relieved though.
I'm so glad.
I almost feel like it was kind of ridiculous to worry about it.
I think that's only natural.
Well, yeah, but when I went into the operating area, it's just like a standard. They had this really bright light and everything. Plain white room, real big. But at the same time, you felt at ease because everybody had something to do.
And they all treat you real good.
Oh, they were right on top of it.
Yeah.
Later.
Okay.
How would you, do you feel like you want to try the Tylenol codeine, or you okay for now?
I'm okay for now.
Okay for now? Okay.
Yeah.
All right. Let me know if you change your mind, okay?
Okay. I feel like I have a mustache. I didn't know it was there when I woke up.
Oh, you didn't? Did they have to try to wake you up?
No, I don't think so. Unless they did, I don't know. It's hard to eat with this thing hanging over your lip.
I'm gonna grab my camera
Okay.
because I want to send a picture to.
You could even take a video. Could I have my phone? I knew I'd ask for it.
I'm gonna stop this for a minute, okay?
Yeah, that's fine.
You feeling any better, Ashley?
Yeah, and this is just to catch the blood.
Yeah.
You know, like, it's like gauze. It looks funny. This I have to keep on for, I believe, a week.
Yeah, and they're the ones that take that off, I think.
Yeah. But it's really not that bad.
Well, I'm glad.
It probably seems more scary, but
Yeah. Did they say what you could eat and what you couldn't eat?
not yet.
Okay.
See, I just got out of the recovery area.
Okay.
My two babas are back at work.
At first I thought I was going to have the operation here.
Well, you did.
No, they moved me back to the operation room.
Oh, I see what you're saying. Your Uncle David says, can't wait to see the new Ashley. Bet she's beautiful. Hollywood may be calling.
I'm getting 4G here. Boy, I look terrible.
Usually.
I thought my eyes would be more darker.
Well, they will. It takes time.
I already have 2 likes.
And then Nancy says, way to go, girl. It's a new you.
Oh. Well, I'm still me. I just, yeah.
But yeah. We're trying to touch it.
I told the nurse, I said, I think that's the best sleep I've ever had.
You know, that's exactly what your Papa Wiggins said. Whatever it is that they use, he said that he slept so relaxed.
Yeah. But yeah, that thing that they call a cocktail, it was like real white. It was like a thick white thing. And the heart monitor things that they put on, they were kind of cold.
Oh, yeah.
She warned me. Everybody was so sweet.
That's really good.
But yeah, as far as I know, I just woke up on my own. And I asked them, I go, so you guys don't do just nose surgeries, you do other things? And she goes, yeah, they do like knee surgeries.
Oh.
Yeah.
Mm-hmm.
I think she said foot, but I'm not sure. Like all kinds of things.
Mm-hmm.
And I said, well, that's gotta keep it interesting.
Sarah says, aw, I'm so glad it's over already. Now the healing process and drugs. Haha.
I forgot to text Michelle.
So you put a picture on Instagram?
Yeah. I'm not really worried how it looks either.
Well, no, it's expected, you know. How is your pain level right now, honey?
Maybe just a tight, like a 1 or half of 1.
Because she said to let her know if you need anything.
You know how when you got a cold and you're stuffy,
Yeah.
you swallow, that it's like that pressure
Yeah.
just kind of makes a weird soapy noise. Or
Yeah.
That's what mine's doing right now.
Yeah.
But yeah, they just give you IV. She had trouble finding the vein in this hand.
Oh, she did?
Well, I have veins that you can see, but they're not straight. And because they put one of those tubes in there, there's like a bubble thing. They need to have like a straight vein. She goes, you have straight veins in there, so she just used this hand.
But she couldn't find it in your right hand?
They want to try they usually do the right hand, but she was able to do it the left.
Huh.
So that bubble won't kill me.
No.
Yeah, I could tell there's like...
Dad says, I'm happy for her. I'm glad that's behind her, too. They're probably, I don't know if they're going to keep you here until this is all done. Or what they're going to do.
You could probably stop recording. I thought it'd be more loopy. Okay, so now I'm back home. It only took me like an hour or half an hour or whatever to be in the recovery room. But I think it took like, what, an hour for the surgery? Or
Yes.
45 minutes? Yeah. They got me back there really quick. I have plugs at my nose, so I sound really stuffy, but I'm not. And then I got gauze over here. But the plugs are like way up at the nose. And they like dissolve or something. And then I have a split. It's not really, they didn't call it a cast, but it's like a split, so it looks really weird, but yeah. So, I get to eat whatever I want. I'm not really hungry though right now. I'm really thirsty because I can only breathe out of my mouth. So yeah, it wasn't that bad. They were really nice, and there was like warm blankets and everything, so they did really good at making you feel comfortable and stuff, so it was awesome. So if you have a broken nose, I would recommend going to them. It was what was it called? Allied
Physicians.
It was really good. I would recommend it. It's still going to be bleeding for a few days though. She said that would be normal. So I have to change out the gauze every once in a while, which I already have. This is a newer one, but yeah, the doctor I had, his name was, I think, Stephen McTigue. I think Stephen is his first name. But yeah, he's really nice and really good at what he does, so it was cool.